innovative acupuncture and massage technique for rapid pain relief. A significant improvement in pain recovery rates. Journalist, International Association of Natural Health, AI Xiaoxin. In September 2025, at the International Acupuncture Congress in Stockholm, Sweden, a new rapid pain relief technique combining acupuncture and massage, known as the 3C technique, was officially presented. Its simplicity, speed, independence from traditional meridians and acupoints, and the originality of its approach won the admiration of experts from around the world. After the Congress, these experts spontaneously created a WeChat group called 3C 2025 Sweden to study the method. The very next day, upon returning to their clinics and practices, they enthusiastically and with great surprise published their first clinical reports using the 3C technique. How was this new technique developed? An orthopedic surgeon trained at a University of Chinese Medicine, eager to help the many patients suffering from pains that could not be cured with chemical medications, went to work in an acupuncture clinic in France. He believed that the acupuncture techniques he had studied for years, the meridians and acupoints he knew so well, would shine abroad. But disappointment came quickly. He realized that the traditional acupuncture he had mastered did not offer the expected effectiveness in treating pain. Faced with patients in need, he often felt a sense of guilt. One day, by chance, a friend told him about Tung's acupuncture, a method related to but different from the traditional meridian system. To his great satisfaction, Tung's acupuncture provided markedly better clinical results than traditional acupuncture, with certain points producing remarkable outcomes for specific types of pain. However, these astonishing points were far too few to address the vast variety of painful conditions encountered in clinical practice. He then studied Tan's meridian balance method, known for its instant effect, as well as Wang Wenyuan's balance method. Their effects on pain were slightly better still, yet he continued to feel an unshakable regret. The effectiveness was not high enough, the speed insufficient, the simplicity lacking, the methods too complicated, too difficult to memorize. Imagine an acupuncturist searching through a book while placing needles. It made no sense. He suspected the real answer must lie elsewhere. Until one day, a chance experience completely transformed his understanding of pain and revealed astonishing phenomena within the human body. Drawing on the keen observational skills of an orthopedic surgeon, he suddenly noticed, during real-time acupuncture treatments for pain, that there existed subtle correspondences between different parts of the body. These were not the lines drawn in meridian diagrams, but rather a three-dimensional image correspondence, based on bodily forms. By organizing these correspondences, he developed a system that was complete, clear, and easy to understand. He named this system the Crossing and Corporeal Correspondence System, abbreviated 3C. What struck him the most, however, was not the name, but the clinical results achieved through this system. The 3C system responds equally well to massage and acupuncture. Thus was born the 3C technique, an analgesic effect far superior to all the acupuncture methods he had previously learned. No knowledge of meridians or acupoints is required. The practitioner can very quickly locate the zones or points corresponding to the patient's pain. Patients often ask, "Oh, how did you know it hurt there?" Never any needling or massage directly on the painful area. Relief comes faster, without deep insertion, without special manipulation, and through a simpler technique. Effective not only for common pain, but also for mysterious, chronic, resistant pains whose causes have remained unknown for years, sometimes relief in just a few seconds or minutes. Thanks to the precision of the points, some pains move during treatment. The 3C technique makes it possible to track and eliminate them completely, a first in the history of acupuncture. Patients often say during the treatment, "It's magical." The doctor who relentlessly searched for better methods, unsatisfied with traditional approaches and their known effects, is Zhu Weimin, former orthopedic surgeon at the Xi'an Red Cross Hospital in China. In 1995, he went to France for advanced training, where he obtained his license to practice clinical orthopedic and trauma surgery. He now works as an orthopedic surgeon at the Annonce Geneva Hospital Center and is also a registered acupuncturist in Switzerland. The person who recommended he learn Tung's acupuncture was Yang Yibin, a doctor of Chinese medicine in Lyon. Dr. Zhu states that the 3C technique is a method of ultimate simplicity. It does not rely on meridians or traditional acupoints, yet it far surpasses other acupuncture methods in pain relief. After the conference in Sweden, feedback from more than 2 months of clinical application revealed that some practitioners had not fully mastered the technique. At the Congress, time was limited. It was impossible to explain all the points in depth, there were no practical sessions, and only a few patients were treated quickly, without detailed explanations. Yet it is essential to clearly understand that this technique is based on 3 fundamental principles. 1. The principle of the same trajectory. This principle had already been used in isolated ways within some other acupuncture techniques, for example, the San Guan point in Tung's acupuncture for treating heel pain, the elbow pain point in Wang's acupuncture applied to the knee, etc. However, these methods had neither recognized the importance nor the deeper significance of this principle. Before the 3C technique, no one had formulated the principle of the same trajectory, nor established it as a key principle in pain treatment. It is true that one can sometimes treat along different trajectories and obtain decent results, but not the optimal level of effectiveness. 2. The principle of crossing. This principle originates from the ancients and has long been used in various acupuncture methods. But without combining it with the principle of the same trajectory, its effectiveness decreases greatly. Even when applying crossing, if one remains confined to the meridians, results are reduced. This is the case, for example, with Tan's instant effect acupuncture technique. Why has the importance of crossing long been underestimated? Because 2 principles transmitted by the ancients were not properly understood: treat below for what is above, treat above for what is below. Treat the left for what is on the right, treat the right for what is on the left. These 2 principles were separated, causing the notion of crossing to disappear. For example, for a disorder of the left upper limb, one treats the right upper limb. The practitioner applies only one principle, left-right, right-left, but forgets the other. For a disorder of the left upper limb, one treats the left lower limb. Here, only one principle is applied, above-below, below-above, while the other is forgotten. Thus, no crossing occurs. Why? Because these 2 statements do not appear in the same text. It is like at school, if the teacher says one day, be on time for school, and the next day, hand in your homework on time, good conduct means applying both principles simultaneously. Likewise, when one follows both ancient principles, above/below and left/right, at the same time, crossing emerges automatically. Only when the pain and its corresponding point lie at the center of the body, or on the same horizontal level as the central point, do the 2 principles naturally merge into one. A practitioner who applies both the principle of the same trajectory and the principle of crossing will already achieve good results. But to reach the highest level of effectiveness, a 3rd principle must still be added. 3. Corporeal correspondence. This is a method that completely abandons meridians and traditional acupoints. It includes 2 components: 1. Abandoning meridians and acupoints. 2. Corporeal correspondence. These 2 aspects constitute the major contribution of the 3C technique to acupuncture. Without meridians, the method becomes extremely simple, saving a great deal of time and making practice faster and easier. Without fixed points, there are in fact an infinite number of possible points, making the technique highly flexible and extremely precise. It is precisely this precision and effectiveness that allow 3C to stand out. It makes analgesic techniques more targeted and more efficient. This is the most important aspect. It reflects the spirit of Sun Tzu's The Art of War. The army has no constant formation, water has no fixed shape. He who can adapt to the enemy's changes will win. That is true genius. Thanks to this principle, the technique can pursue the pain when it moves and eliminate it completely. According to reports, before learning the 3C technique, acupuncturists' satisfaction rate in treating pain ranged between 20% and 50%. After learning 3C, this rate rises to over 90%. Some may wonder, does this challenge the traditional meridian theory? Does it mean that meridian theory is unscientific? Dr. Zhu gives two answers. 1. The value of the meridian system cannot be measured solely by its analgesic effectiveness. The 3C technique is primarily for treating pain, whereas the meridian system, for thousands of years, has explained the physiology, pathology, and yin, yang and qi, blood dynamics of the human body. One cannot deny the validity of the meridian system simply because the 3C technique is more effective for pain. 2. The 3C technique does not deviate from the core concept of the meridians. The essence of the meridian system is, there is no place the meridians do not reach. Any place can become an acupoint. The 3C technique illustrates this very idea. Any part of the body can become a point if its correspondence with the painful area is accurate. Today, this new technique has already helped cure many complex and difficult clinical cases, including patients suffering from persistent chest pain for 2 years, hospitalized long-term with no clear diagnosis and having sought help from multiple institutions in vain, sequelae of COVID-19, a patient afflicted for 5 years with vulvar leg pain, undiagnosable and untreatable in hospitals, postoperative scar pain lasting 7 years despite multiple hospital visits with no result, intestinal pain, various cases of osteoarthritis, post-traumatic pain, and a patient who endured 30 years of back pain with no improvement despite repeated consultations in France and Switzerland, and many others. At the International Conference in Stockholm, Sweden, acupuncturists and therapists from more than 20 countries and regions express high praise for this innovative technique, believing that its dissemination would greatly improve the clinical outcomes of acupuncture in pain treatment. Several experts predict that this method could bring major breakthroughs in future pain management therapies. They warmly commended the author for his altruism and benevolence in sharing, without reservation, the fruits of many years of research with doctors and patients around the world, so that more people may be freed from pain. Over the years, this technique has been verified and applied by several clinicians, including Dr. Yang Yibin in France and Dr. Sun Yuxiu in Canada. After the Stockholm conference, doctors from several countries also tested it, and their feedback can be seen in the screenshots from the WeChat group, 3C 2025 Sweden. A link is provided below the video. Readers wishing to join this group to learn the 3C technique for free may be added through an acquaintance or may leave a message in the comments section below this page. The Chinese, French, and English editions of the book, Rapid Pain Relief with 3C, have been preserved by the National Library of France as part of humanity's permanent heritage. A purchase link is available below the video. The International Association of Natural Health regularly organizes training courses on the 3C technique. Those interested are invited to regularly check the association's website for details, https://santemtc.com. Thank you very much for your attention, and see you soon.